Good morning and welcome to our live talk program. This is Lloyd Grove here, your host on Revive Reform Radio, doing our live talk program covering natural health on your Wednesday morning Rise and Shine. And this morning here, we're looking at two topics in one: colorectal cancer and opioid epidemic, or the drug epidemic. So, colorectal cancer and drug epidemic is what we're looking at here this morning. I have four articles to share with you, and just some thoughts on what's going on in our country at the moment, and just focusing on the health of our people. So this is what we're looking at here this morning, top of the morning to you. Hopefully you had a blessed night rest and you're ready to take on today, the day that the Lord has given you, another day. Let us begin with a short prayer. Our Father, who art in heaven, we thank thee again for the blessings of this day. We thank you for the blessings of being able to be awake and in our right minds. Pray that you may be with us as we look at these things that are going on in our society. May you bless and guide us, we pray, for Christ's sake. Amen. So our topic again this morning here, we're looking at colorectal cancer and the drug epidemic. And I'm going to go straight into it because I have a few articles that I want to share and some commentary that's important for your understanding and for just looking at what's going on. So I'm going to start out this morning by looking at colon cancer. And I'm going to take this information here, this piece by Maggie Fox over there at NBC News. And it's entitled "Deaths from Colon Cancer Are Up in Younger White People." So this is the topic: deaths in colorectal cancer or colon cancer is up in young white people. Now more Americans are dying from colon cancer at younger ages, and researchers are not sure why. So this is happening, and researchers are not sure why. New statistics from the American Cancer Society show death rates from colon cancer have been increasing steadily among people under 54 since 2004. The effect is only seen in whites. Death rates are falling among blacks, another finding that confound doctors. This incident is real, and it's scary because we don't know what's causing it, says Rebecca Siegel of the American Cancer Society, who lead the study team. The increase was confined to white individuals, among whom mortality rates increased by 1.4% annually, the team wrote. Earlier this year, the American Cancer Society reported a puzzling rise in colon cancer rates amongst people born in 1990 or later. Now they're showing an increased death rate too, which means that an increased emphasis on colonoscopy is not simply turning up more cases of cancer that otherwise people may not have been noticed. It is not just more colonoscopy. We're having more disease for some reason that we don't understand, Siegel said. So more disease coming from just basically more deaths. So this is important. I just paused there because I want to make sure you get that. They're saying basically it's not just that they're doing more screening, and because more screening they're catching more people with the cancers. They're literally having more people dying, which is different from just saying, well, because we increase screening we're finding more people with the disease. No, it's not just that. People are literally dying, so there is an increase in colon cancer, and they're saying it's confined to whites. We continue here. Earlier this year, the American Cancer Society reported a puzzling rise in colon cancer rates amongst people born in the 1990 or later. It is not just more colonoscopy. Colorectal cancer is the third most commonly diagnosed cancer in America. Colon cancer will be diagnosed in more than 95,000 people this year, and nearly 40,000 will be diagnosed with rectal cancer. The two cancers will kill more than 50,000 people this year, making colorectal cancer the second leading cause of cancer death in America. The look at data is going back 40 years or more shows that death rates from colorectal cancer have fallen since 1970 in African American ages 20 through 54, but that they've risen among whites ages 30 through 54. That's puzzling since obesity and diet are strongly linked to colon cancer risk, and Black Americans have higher rates of obesity and are less likely to eat recommended healthy diets than white Americans are. So keep that in mind. And if you listened to my program yesterday, where I was covering a health topic, although it was on the church day, keep that in mind because blacks are normally larger in general and eat a more soulish diet. So my second set of information I'm going to share this morning here is going to shed light on the puzzle that they have in their research. Because you're reading here, colorectal cancer incidence has been increasing in the United States among adults younger than 55 since at least the mid-90s, with the increase confined to white men and women, most rapid for metastatic disease, Siegel team reported in the Journal of American Medical Association. And even though there are better treatments for colon cancer that can help people live longer, healthier lives, the increase in death rates outweigh the effect of better treatment. So that means no matter how much better the treatment is, more people are still dying. The increase in death rates shows us that the increase in incidence of sufficient magnitude to overcome the improvement in survival that we have seen because of better treatments in more recent years. Part of it may be that not enough people are getting screened on time, Siegel says. We also found increasing death rates for people in their early 50s, for whom screening has been recommended for decades. And this was the most surprising finding because screening for colorectal cancer influenced death rates because it both prevent cancer and detect it at an early stage when it's more curable, she says. People aren't calling to schedule their screening tests on their 50th birthday, but they should be. American Cancer Society guidelines recommend starting colonoscopy at age 50. People with a family history of colon cancer or who have a relative who had a high risk non-cancerous growth called an adenoma should consider starting sooner. There are varieties of screening tests, Siegel added. The most common, of course, is the colonoscopy, but there are many other options for people who decide, for one reason or another, that the colonoscopy is not for them. Doctors are not certain that it's time to change screening recommendations and send more people for colonoscopy at younger age. Colonoscopy themselves carry risk and expense and usually required sedation. But one problem with colon cancer is that it does not usually cause obvious symptoms until it is advanced. Kathy Rich of Rockville Center, New York, was diagnosed with stage 4 cancer in 2012 at the age of 33. She had a 2-month-old baby and 2 older children. We have no family history of colon cancer, Rich told NBC News. I was pregnant from basically 2009 to 2012. I had 3 kids in 3 years, and any symptoms I may have had was masked by the pregnancy. Rich had actually undergone a colonoscopy at age 20 for abdominal and stomach issues and had been cleared, but she was aware of the risk of colon cancer. I have 2 brothers who were tested, and one brother actually had an adenoma, and it's basically like a precancerous polyp that was removed, she said. And according to my oncologist, that polyp would have turned into cancer. I think she said 3 to 5 years. And he would not have been 50 by then, so he would have had full bone cancer. Rich had surgery and chemotherapy and a fourth child in the middle of her treatment. She's unlikely to ever be cancer free. Right now, she's raising her family. Other studies show that cancer survivors who follow the standard American Cancer Society guideline for healthy living are 42% less likely to die than similar survivors who didn't. Rich has no clear advice for younger people. I want to say, listen to your body, go with your gut, but my body never gave me any sign, and my gut never told me, Rich says. Siegel said there are clear guidelines for people who want to prevent colon cancer. The main risk factor for colorectal cancer that we know of are obesity, physical inactivity, alcohol consumption, and smoking, she says. We don't think that the obesity epidemic is driving this trend because we see different trend in the black and white community. As is so often the case, more research is needed. In the meantime, Dr. Renald Blade, chief of the colorectal surgery of Boston Brigham and Women Hospital, say doctors may need to think colon cancer more often than they otherwise would have. I think that's the main thing about this paper, to raise the awareness of both the patient and the provider, of thinking about colon cancer as a problem in patient in the 30s and 40s. And Blade who was not involved in the research. So here we have an interesting puzzle for the medical professionals and those who do research from the American Cancer Society. And their puzzle is, why is it that colorectal cancer, according to this research that came out, I think, yesterday, why is it that colorectal cancer is risen amongst whites only, male and female dying at higher rates, and while it's decreasing for blacks? So if you take that into consideration, and then now you go to my second thing I want to share this morning here, what I simply did was just because I know the answer for the question, and I'll tell you the answer for the question. The first I read the article, my first answer for the question is beef. That's my answer for the question. Beef and pork. Those are the two things that came to my mind. So when they say we don't know why, because they say normally the main risk is sedentary lifestyle, not enough smoking, drinking alcohol, and whatever the third thing they say. So when they said that, I said, well, beef, pork, and then later on, low fiber. So somebody would say, well, why would you say beef, pork, and low fiber? Don't black Americans eat beef, pork, and have a low fiber? Because remember, obesity was the next thing. Yeah, the fourth thing was obesity. So you would say, well, black Americans normally are bigger. Well, black Americans are bigger, but they normally we have more diabetes. But here, when you think about cancer, cancer is synonymous with whites. So then you have to say, well, what is it that the two groups don't per se have in common? And one of the quickest thing you can come to answer is beef, pork, mainly. The fiber is what it is. Some people eat it, some people don't. But this is what it is. So because I thought about that, so I said, why would you think about that? Because I understand what called colon cancer. Colon cancer would be normally driven on by more meat, but red meat, from my years of reading about these things. So I just did a quick query, American, so meat associated with colorectal cancer. So you can do the same query in your Google. And one of the things you'll come up with is the U.S. National Library of Medicine, National Institute of Health, the NCBI, NLM, NHI government website. And you could come up with this website and you'll pull research on this, and you'll see that the research proves why it would be so. Because who eat, normally you say beef, you're talking about like people in Pennsylvania and stuff like that. Meat and potato. That's all, just slab of meat, potato. What's been one of the biggest trend that young people go to recently? When it comes on to food, it would be steakhouse. Lots of steakhouse. You see these steakhouse, you go past these steakhouse, you think they are giving something free away. You think it's like, Black Friday or something. The place is packed. And it's packed a lot with young people who find this type of stuff, eating a slab of meat, fanciful. This concept here, remember a few years back, I'm going to read it in a second, but it's a quick abstract, so it's not a lot, so I have to comment here. I remember a few years back, there was this thing called a high protein diet. I think it's still around. I'm not too much into what's going on in that front, but high protein diet where you cut back on carbs and you just do a lot of protein. You probably do some berries and stuff like that, but you do a high protein diet. And back then, probably about 15 years ago, many people, including myself, would say, look, this is going to give to a rise of colon cancers because low carb, also a lot of time associated with low fiber. What it's going to do? It's going to cause colon cancers because all that meat is going to stuck in the colon. People are going to be constipated, and the meat is going to basically destroy the colon because meat is a cancer-causing agent. So here we are now. We're seeing the results of it, but we're seeing the results which I couldn't predict. Result primarily with young people, which is, to me, fascinating stuff here going on. So here's the numbers. This is from the National Institute of Health, and this is the abstract from one of their big research. Colorectal cancer, CRC, is the third most common cancer in men and second in women worldwide. More than half of cases occur in more developed nations. So most of it, half of it, across the world, half is coming from developed nation. Again, a lot of beef consumption. The consumption of red meat, beef, pork, lamb, veal, mutton, is high in developed countries, and accumulated evidence until today demonstrated a convincing association between the intake of red meat and especially processed meat and CRC, colorectal cancer. In this review, meta-analysis of prospective epidemiological studies addressed this association, observed link of some subtypes of red meat with the colorectal cancer risk, potential carcinogenic compound, their mechanism, and actual recommendation of the international guide for are presented. So a whole bunch of information there that I'm not going to share. And then I go to the conclusion. As a conclusion, accumulated evidence of prospective epidemiological studies and their meta-analysis showed that red meat and processed meat convincingly increase colorectal risk by 20 to 30%. Convincingly. Regarding specific red meat type, the association with increased risk was found for beef consumption in 2 trials. One of them was a weekly associated. For pork consumption in 3 trials. For lamb intake in 1 trial. So, see that numbers there. An interesting observation is the existence of this risk only for pork intake and rectal cancer and lamb intake and colon cancer, respectively, in 1 trial. Very interesting here. They're even breaking it down and showing you. And as I say, all the information is there. You can go on the website that I just told you, and you can see the breakdown. And you can see that you eat pork, they're saying. One of the trials actually came up with this thing that rectal cancer in pork and colon cancer in lamb, respectively, in 1 trial. Another trial, beef and pork consumption was found also to be associated with colon cancer only in women in 1 trial, which is fascinating again. Whether colorectal cancer is one disease or the existence of 2 categories of colorectal cancer and rectum, or proximal or distal, or right and left colon, and the risk between etiologic factors and molecular subtype are another hot topic of discussion which needs further investigation. So I just say this here, what they're saying. Basically, because some of the studies are showing that if there's a eating of, say, pork, you're more likely to have rectum, so lower down. If you eat lamb, it's more likely to be a little bit higher up, colon. You eat something else, is more likely to go to the left colon, right rectum, or anywhere in the proximity. So fascinating that the different animals, because remember, animals are your primary conveyor of cancer. So the different animals the person eat, it tells you what type of disease. And it's true because you think about it, chicken is associated with leukemia. Different animals are associated with different cancer because they're primary carrier of cancers. So what cancer, what part of the body is more susceptible? Well, whatever cancer that animal carries. And this is how I understand it. You look at the animal, there's a certain cancer that it carries, bam, a certain weakness it has. This is where the problem is going to come. Almost there on this piece here. According to the guideline that was put forward, they're suggesting that people should reduce the amount of meat. Note here again, next paragraph is that white meat, fish and poultry is not associated with colorectal cancer and is recommended safely. So they just say, well, you can eat white meat. So if you're talking about, if somebody say I'm susceptible to colorectal cancer, they would suggest white meat because they're saying it's safe. I'm not suggesting it because, as I said to you, each of these animals give you a risk of a different type of cancer. But yet, when it comes out to colorectal cancer, they have not found the evidence that chicken and fish are associated. Keep reading here. It says to diminish carcinogenic effect, diet should be high in dietary fiber, source such as wheat bran, vegetables, right? And also they think you should wrap your meat in aluminum when roasting it or microwaving it. And then you should use different trimming process to decrease the amount of fat because fat normally associated with pesticides and drugs. So the fat normally stores poison in the system of you know anything with flesh. So they're suggesting trim away more of the fat, and we stop there. So that's from the again, I give it to you if you want to go read more yourself. ncbi.nlm.nih.gov. If you want to go there and search that and pull that up, or just put in your Google search meat associated with colorectal cancer, and you'll get many different articles, not just this one. I just choose this one that will pinpoint it what meat is hitting the colon terribly. And it would be primarily beef, pork, but they throw in there lamb, veal, mutton. So goat, lamb, and whatever veal is. I think lamb again. So, all right, here's that number. So when you look now, take the two things together. All right, so the first half here, I'm still dealing with colorectal cancer. So here you have, they come out with a research yesterday and they say, well, what our finding is that this is a puzzle. Whites at a higher rate each year are dying from colorectal cancer. And this is puzzling because blacks aren't, because normally one of the sign of colorectal cancer is that a person normally is a bigger person, obese. But then you'd have to dig deeper. Well, if there's two people obese, or say you have to give a bigger sample there. So if 100 people are obese and 100 people they smoke, they drink, they have a sedentary lifestyle, and out of those 100 people, the blacks are having a decreased rate of colorectal cancer, the whites are increasing and dying more. Well, what's happening? Well, that make me now say, well, there has to be another factor. But if you go and just look at the current research that's out there, you see very quickly that the factor that pushes colorectal cancer is actually the type of meat. Well, when you look at it again, normally you say, you normally you normally say for the most part, chicken, fried chicken especially, as I was covering yesterday, they're trying to cut that out of the diets. Fried chicken is normally more associated with blacks. As a matter of fact, I remember when I came to America, I realized they made fun of blacks for eating fried chicken, but normally whites would more eat your pork, your beef. But again, these things are associated with certain type of cancer. So when you get it from just generally knowing, I don't know if I've ever looked at the research to find out at what rates per 100,000 does black or whites eat cancer, because I'm sure you've seen recently where the president would, I guess, I don't know if it's a bucket of chicken on Air Force One, but he will eat like chicken and burgers and stuff like that. He eats like a child. So you normally would say, whites do eat chicken. But you never saw a picture with, say, President Obama eating chicken on Air Force One, fried chicken. But anyhow, so you see this type of thing where it's normally an idea that white, at least from my being in America, white eat slabs of beef, but slab of beef is associated with colorectal cancer. So for me, it's a straightforward, simple understanding. It's just understanding what people eat and what causes cancer. Again, the primary cause of cancer: smoking, alcohol, meat. Those are your primary cause of cancer. It's just they have been trying to avoid as much as possible talking about meat as they would talk about, say, smoking. But when you understand, meat drives your primary cancers: fish, chicken, pork, lamb. It's just the different type of cancer pushed upon by the different type of meat. If you're a big beef eater, you should get, no matter what your age, you should get colorectal or colonoscopies, because you're susceptible to have, I don't know, whatever that thing is, you're susceptible to have those polyps, cancerous polyps that will lead to cancer. So keep that in mind. Again, if you've ever eaten heavy slab of steak or any type of meat, but especially like steak or anything like red meat, if you know what I'm talking about here, you'll know that what is associated with heavy red meat is constipation. This is why it's almost required, and not everybody does this, to have fiber with beef. But you think about the average person eating, especially white, as I've seen it. And I remember one time there's a friend I used to work with, and I remember I would go to the diner and I'll just bring like a smoothie and I'll watch him eat, and I'll feel like sometimes I want to gag. Like literally, I would be like at the table trying to hold my vomit, because it would just be this meat that looked like, if I just boil like minced beef, and it just have that brownish look on it. I smell like it's like dead rotten carcass. And that was what it was like. But it was slices of that you would have with potato. And if there's some fiber in there to a certain degree, but that's constipation, period. That's just straight constipation. You just slabs of meat with potato, and that's normally the diet. And so you would have, going back to what I say, whites over here obese, blacks over here obese. But the difference is one is eating leukemia, one is eating colorectal cancer. That's just how I look at it. It's just straightforward. The two of them are huge, but one is eating colorectal cancer, one is eating leukemia and other type of cancers. One is chicken, one is beef. One is going to more lead to heavier constipation. And as when you're constipated, what happened now? Finally, here, the beef now is, and because the beef or the pork or the veal or the lamb is stuck now in the colon primarily. Because why I say the colon? Because the colon is where the food now goes from like a chyme, like a thick smoothie or something like that, and it goes to where it starts to get compacted. But no, if the person is impacted, they have like a cork in their anus, and nothing is moving, that area now, probably last 6 feet or so or less, has compacted feces. Well, that compacted stuff that's not moving has meat, and it's meat that is not properly broken down. And the reason why it's not properly broken down, because most people really don't chew their food. I'm sure you've seen people that actually just give 2 bites and swallow. So the food now, the meat is whole. It survived the acid, and it's now whole, and it's now a whole piece of protein that has cancerous lesion in it. And these cancerous things now are stuck now and on the colon walls, moving very slowly. Just imagine this. And as you can imagine, as you see now why now that constipation and those pieces of meat with cancer in it, now the cancer get transferred into the colons. And if it's not transferred, what it is, the meat now is rotting and putrefying. And the meat now will burn holes in the colon called what you call diverticulitis. So the person will have pockets in their colon. And what will those pockets happen in those pockets? More feces and meat and putrefaction will get lodged in those pockets and will cause more diseases. So this is why sometimes people are coming out with all these. Again, you'll find this again primarily people are obese, but also people are white, irritable bowel syndromes, Crohn's disease, and all the other stuff that I forget all of a sudden. But anyhow, you'll have all those diseases because what you have is all those rotten meats that are there. Then if the meat is rotten and filled with like little vermins, little pests, whatever you call them, worms, those worms now start to multiply in the colon. The colon becomes sick. And that person now needs some serious therapy for their colon because it's a mess right down there. And so that's what it is. So again, you think about it. What's one of the biggest trends in America right now? Steakhouse. You know, a lot of the diners are turning into steakhouses. They just renovate them, turn into steakhouses, and they're packed. What's going on there? They're having, diner food basically. There's that upscale diner food with what? With some alcohol. Again, a colorectal cancer risk, and there you go. And everybody's getting larger. So that's the type of things going on. So colorectal cancer is on the rise in wise, as I say. That's mad. Now again, probably a year from now they'll come out and prove something different. But I'm actually calling this one, and I'm going to say, based on my understanding of how the colon work, how digestion work, how the food get compacted in the colon because all the water is pulled out of the food as the food is going to exit. I'm calling it that if you understand that process, you understand meat is a primary causer of cancer, beyond, probably only secondary to smoking, and probably third would be alcohol, and then fourth, a sedentary lifestyle. Then you would understand now why I believe now that compacted in the colon, removing of the water of the food, and you have all that dead, decayed meat in the system, colon cancer. Person with chicken, more leukemia, that type of thing. So anyhow, that's the type of thing that's going on. So we see there. So that I cover. I'm gonna move on again to another article. Now we're gonna talk about the drug epidemic because this is an ongoing thing that we can't. It seems like we can't. It's not. We're never gonna get to the bottom of it because there's two things that are driving drugs. People are three things: pain. People are depressed or sad about life, and then people are looking for fun. And however people are getting to it, we have a drug epidemic in the country, period, across the board. Remember, when we talk about drugs, we have liquid drugs, which is alcohol, is a mocker, and then we have the powdered stuff or the liquid stuff that you can shoot into your veins or take via tablet if it's compacted. So, first thing here, I want to read now where this is something that I've been talking about, especially with a brother from the church, and more and more the numbers are being proven. And I remember a few years ago he was saying to me, Brother Ernest, he was saying to me that the drug epidemic is worse. And from his knowledge, he was saying and experiences, he said, look, I'm going to tell you the drug epidemic is worse. And when he said it, I said, and whatever he was explaining to me, I says, I believe it. He called it probably a year or two ago. And he called it, he said, this thing is worse than they're reporting. And then he explained to me how the street works. And then he says, that's what I'm saying, it's worse. And so far, it's been proven right. It is worse. And over the years, I keep seeing article after article, more research coming out that's saying this problem is larger than what the society originally, or the medical professionals originally thought. So here's an article, yesterday again, or today, this morning, I think, that is making that claim to be so true. Look at this. This is opiate crisis. The awful arithmetic of Americans overdose may have gotten worse. And this is from Corey Sizemasco from NBC News. It says here the deadly drug overdose epidemic that has been ravaging the nation may have even been worse than we realize. A new University of Virginia study say the number of deaths due to heroin and opiate overdose have actually been severely underreported. Dr. Christopher Rum revisited thousands of death certificates from 2008 through 2014 and concluded that mortality rates were 24% higher for opiates and 22% higher for heroin than had been previously reported. Opiate mortality rate changes were considerably understated in Pennsylvania, Indiana, New Jersey, Arizona, the study states. Increases in heroin deaths were understated in most states and by a large amount in Pennsylvania, Indiana, New Jersey, Louisiana, Alabama. Rum's awful arithmetic emerged just days after the Presidential Opiate Commission, led by New Jersey Governor Chris Christie, urged President Donald Trump to declare a national emergency to deal with the crisis. Nearly 35,000 people across America have died of heroin or opiate overdose in 2015, according to the National Institute on Drug Abuse. My message to members of the Presidential Commission would be that getting the most accurate statistic possible is a crucial first step towards developing policies aimed at stemming the fatal drug epidemic, Rum told NBC News. This is particularly important when we have scarce funds to allocate and so would want to target them at the hardest hit areas. Rum contends that one of the reasons U.S. officials have been unable to win this war is the lack of reliable information on the drugs causing fatal overdose. This occurs when no specific drug is identified on the death certificate, he said in the study. So Rum's professor of public health policy and economics began poring over death certificates data from the Federal Center of Disease Control and Prevention. His discovery that in 2014 a specific drug was not mentioned in 90% of the fatal overdoses. And in 2008, that figure was even higher, 25.4%. States like Rhode Island, Connecticut, New Hampshire specified the exact drug on death certificate 99% of the time, but only around half the time in Pennsylvania, Indiana, Mississippi, Louisiana, Alabama, Rum reported in his study. Armed with that information, Rum estimated how many of those deaths could be blamed on heroin and how many on opiates. His results, the national rate of fatal opiate overdoses jumped in 2014 from 9 in 100,000 people to 11.2, and the rate of fatal heroin overdose climbed from 3.3 to 4. Based on Rum's research, the drug problem in Pennsylvania is a lot worse than the CDC figure indicates. The Keystone State was ranked 32 by the CDC for opiate deaths in 2014 with 8.5 per 100,000. But Rum claimed the Keystone State actually has the 7th highest rates of opiate deaths that year, with 17.8 per 100,000 people. And based on Rum's calculation, it went from being the state with the 20th highest fatal heroin overdose rate to the 4th. That's a major jump. These numbers are alarming and underscore the need to continue expanding treatment, education, awareness, and resources for law enforcement and health professional. J.J. Abbott, press secretary for the Pennsylvania governor, Tom Wolf, wrote in an email to NBC News. As part of the ongoing strategy to address the opiate crisis, the administration is working on creating a public-facing data dashboard to centralize and streamline information regarding overdose prevention treatment from all of the different sources. That said, Susan Shanaman of the Pennsylvania State Coroners Association said there are many reasons that a coroner may not list all the drugs on a death certificate, including federal and state policy rules. The average family gets 20 copies of a death certificate for their loved ones, she wrote in an email to NBC News. These are used to close out bank accounts, transfer loan accounts, transfer title to vehicle, claim insurance, and the like. Not every family member wants the public to know what drugs were all found in the deceased. So I could see why they would not want to list that. But then that skews the numbers for the state. Hard hit Ohio, opiate death rate went from 18.2 per 100,000, fifth highest in the country, to 20.5 per 100,000, fourth highest in the country. It's a big jump. The report says Ohio has the nation's highest rate of fatal heroin overdose, with 10.4 per 100,000 by RUM's reckoning. The rate is 11.2 per 100,000, which is also the highest in the country. Unchanged is RUM's report, and West Virginia, woeful ranking as the state with the highest rates of deadly opiate cases. But even there, RUM concluded that the death rate for opiates should have been 30.3 per 100,000 in 2014 instead of 20.9. The state's fatal heroin overdose rate should have been 9 per 100,000 rather than 8.8. RUM's research also buttressed earlier studies that identify the primary victims of the plague. Fatal overdose rates are higher for male than females, for whites than blacks, and other non-whites, RUM's report. And the overdose death rates are higher for people aged 25 through 64 in the Rust Belt, in Appalachia and some western states. There are also pockets with high death rates in many other parts of the country as well, RUM's report. So very important report there, which goes to the opiate epidemic. Now what we're having here is a report that the numbers of people dying from the heroin is higher. So as I say, I talked about that in the past. I say, I really believe it's higher. You know, the explanation that I got why it's higher, I was sold on it. I say, yeah, it has to be higher then. Because when you look at certain factors, then you start to understand how stuff works. And what an explanation there before I go to my last article. Like if you think about it, right? If you have like something like this heroin thing that's going on, going back to the death certificate, how this type of stuff is handled is that they would say a person that have pneumonia, but pneumonia could be caused by heroin, or it could be caused by something like AIDS. So you really don't want to list that the person that have AIDS or the person that have pneumonia or heroin on the death certificate. It's better just to list pneumonia. But the problem with that is that it doesn't give you a proper accounting of what's killing people because of the embarrassment. So if the coroner office in Pennsylvania states that, well, there's good reasons why people would not want to list certain things like heroin on the death certificate, there's a strong possibility that there's even more people in Pennsylvania dying from AIDS, and they're not listing it. So they might list it in one place, and it might seem like this place or this town is having more people dying of AIDS. But because we don't want to embarrass the family and we don't want to disclose all that information, we don't list AIDS. But really, we have more people dying of AIDS. If you think about the lifestyle, I always go back to lifestyle. If you think about the lifestyle that many people live, it makes no sense to say that only this group of people died from AIDS. I believe that there's more people, and you hear me calling this. This is one more thing I'm calling, and I'm saying you right now. More people are dying from AIDS in Pennsylvania than they're reporting. I'm just telling you, because it's always go back to lifestyle. When you see people live a certain lifestyle, don't be fooled by their big talk. The lifestyle is killing them because a lifestyle of sin and wickedness will result in death at high rates. So go back to this death certificate thing. They're not reporting it because they don't want to embarrass the family, but that skews the numbers. And as you know, I'm saying that more people, even than what this guy is finding out, has died of drugs because the heroin and the fentanyl and carfentanil can cause even flesh-eating bacteria. So a person could die from MRSA, and it's listed that they die from staph infection. But really what killed them is heroin. A person could die from pneumonia, and what killed them is the heroin, because the heroin depresses the system and it destroys the lungs and it destroys the breathing and causes you to have pneumonia. But if you list pneumonia, it's nicer for the family when they send out all these death certificates to take care of the person's business. But really what just happened was that the person died from heroin. It's the same thing with many people who die from heart failure. But if you properly check it out, you find out that they die from cocaine. So the family say, oh yeah, they die from a heart attack. Oh, they die from a heart attack. No, they die hammed up on cocaine. That's all. But it's better at the funeral and when talking to people to say, it's better to say heart failure because it sounds nicer. But that's not really what's going on. What's going on is cocaine. So when you understand that, you understand some of what's going on in our society, that you can die from a cause, but that's not the cause. Person die with certain complications, but really what they had was diabetes. Really what they should put on the death certificate is both, probably. Whatever the complication is, and diabetes. So you get a proper reckoning of how many people, because there's no way in a society with the levels of obesity that more people are dying from diabetes and heart failure. But again, these things normally is not the end game. For a person, they die from something else, but doesn't mean they didn't die from that. So keep that in mind.